This clinic, Healing Touch Center for Oral and Maxillofacial Surgery, is located in Vasant Arcade, which is in Komba, Margao. Vasant Arcade is located right behind police station, Margao police station. My place is in the upper ground floor, shop number 37.
Timings?
You will be able to meet me from Monday to Saturday morning 10 o'clock onwards till 7 o'clock in the evening. On Sundays also I can make myself available only on appointments. So other than, I do all sorts of oral and maxillofacial procedures, like I am participant of the trauma team. I manage oncology also. I do early detection of oral cancers. At the same time, any cancer patient or medically unfit patient can also undergo dental care treatment with me, as this is the dental oncology unit as well, and I'll be able to provide experienced care, personalized care with professionalism for all these patients. Temporomandibular joint disorders is another area where I would be able to offer a lot of help and care to these patients, where I use biopsychosocial model of treatment. And when it comes to facial trauma, I would say that the maximum injuries that we are seeing is on the two-wheeler accidents, and it is advisable that while people are being on two-wheeler, that both rider as well as the pillion, they both wear a helmet. That is mandatory. At the same time, while riding a bike, please do not text or use your mobile phones and get distracted. Do not be in a hurry. These are some very important things to be practiced in order to avoid any kind of two-wheeler vehicular injuries, which is something that we are seeing a lot, especially amongst youngsters.
Alcohol also affects your oral mouth. So please elaborate on this, and again, out of 10. How much?
It's not very high, sir. I would say that alcohol in the blood and in the tissues of the oral cavity will make it more prone to oral cancer, but it may not lead to cancer as tobacco would. But in case if the patient has any sharp tooth in the mouth, if somebody has a sharp tooth or a carious tooth which has caused an ulcer, that can cause oral cancer. Yeah, let us say, like for example, I have seen a patient in earlier times of my my career, a young man, 33-year-old man. He comes with the ulcer of the tongue, especially this side.
Yeah.
And the sharp tooth is there. He has bitten his tongue. Okay, he is also a tobacco chewer, not so much, but, and this sharp tooth ulcer, initially it is just being neglected as an ulcer, and after a month it has appeared as a tongue cancer. Now tongue cancer is the worst cancer in the mouth, so no sharp tooth in the mouth is required, should be there. Especially if you are diabetic, especially if you are taking alcohol, or if there is a tobacco or male gender, these are the risk factors. So there are risk factors. This factor does not mean that it will convert into a situation. But in case if these risk factors are present, then if you have anything going in your mouth, visit the doctor immediately. Do not wait, and get diagnosed at an early stage. Early detection saves lives. So I practice in Vasant Arcade, Komba. It is in right behind police station, Margao police station town, and we have a beautiful setup, and it's a lot of other well-known doctors are also in this building, and it should not be very difficult, yes, but parking is a problem. My timings are from 10 o'clock in the morning till 1:30 in the afternoon, and then I start again at 3:30 and we finish at 7:30. But we, in case if there is an emergency or in case if we have a patient, then we don't bother about the timing. We continue to work. I never advise bridges to the patient at all. I always advise for a missing teeth only a dental implant, mainly because the cost of a bridge And a dental implant is something which comes almost to the same thing.
Dental implant means you plant that particular.
Yeah, there's a screw, sir. There's a screw which goes. It has. I have put a picture in that in the flyer. There are all the things that are mentioned. We have a very good understanding of how to manage these patients. I even wish to start TMJ arthroscopy. So you may be aware that there is knee arthroscopy or shoulder arthroscopy. TMJ arthroscopy is also something that I wish to bring it into Goa very soon in future, near future. So that's another very niche area which is not happening in, which is untouched till now, and I look forward to bringing this, that kind of care to our patients in Goa. So these are, besides that, I said trauma is one, dental implants is something, another thing that, we have been, dental implants are center totally in today's time. We don't prescribe fixed bridges at all, because in earlier times, you all must be knowing bridges. The moment you remove a tooth, a bridge was offered. But whenever we offer bridge, then we are actually cutting the other adjacent teeth, which are actually very healthy and good. So in today's time, science and medical science and biomedical science has reached to a stage where we are working with minimal damage to the natural and normal tissues, aware of how to manage these patients in the appropriate fashion. And that is where my role comes. Besides that, another very interesting aspect of my training and my experience is temporomandibular joint disorders, which is another. So this particular place, this center is a fully dedicated temporomandibular joint disorder center. I have been already getting references from ENT surgeons and any other doctor who is seeing temporomandibular joint disorders as a TMJ specialist. Now, what exactly is TMJ, temporomandibular joint disorder? What happens is that in today's time, a lot of youngsters, because of the stress and other things, they are developing a lot of joint pains, especially in front of the ears, and they're not able to open their mouth. So it becomes very important. Again, we are coming back to the same thing. Simple thing like chewing food, if you're not able to do it, then it becomes very big problem for our patients. And that is where I developed deep, keen interest in my subject, and through that I entered into into academic practice. In the academic practice, what has happened is that I was educating in Karnataka, Maharashtra, and then my last tenure, which was the longest tenure of 10 years, where I was heading in the department, it was in Government Dental College, Jamnagar, Gujarat. The whole of the facial fractures is actually handled by oral and maxillofacial surgeon. Besides that, we also have a role to play in oral cancer. Lot of our colleagues are doing very good work in the field of oral cancer. So oral cancer is not something that is handled only by cancer surgeons. Even oral and maxillofacial surgeons are well trained. If they undergo proper fellowship trainings of almost 3 years, then they can manage oral cancers. When it comes to my own experience, I have a good experience of early detection of oral cancer. So in Goa, what I have noticed is that the oral cancer incidence rate relatively is very less in Goan population as compared to the migrant population who has come, especially if we have seen a lot of laborers who have migrated from Bihar and UP. They are always chewing the tobacco, and that is what is increasing the oral cancer incidence rate of Goa. But then we tend to think that probably, but in Goa we see alcoholism, okay, and we tend to feel that only tobacco chewing leads to oral cancer. But the research also shows that alcohol consumption also brings changes in the oral cavity. And that is the reason why in Goa I suspect that the causes of oral cancer may be varied. They will be more local in the form of tobacco, but also more general where alcoholism is concerned. So my work has been more involved with early detection of oral cancer, where I have done immense work. And where we We have taken patients with white lesions or red lesions in the mouth or ulcers in the mouth, and we have detected that yes, this is something that is starting stage of oral cancer. That way, if you pick it up at a starting stage, then you can save the life of a patient, because once the oral cancer is already formed, then even if these patients undergo a lot of treatment of chemotherapy, surgery, radiotherapy, blah blah blah, everything happens, but they cannot recover 100%. And you know, when you cut the jaw, mouth tissues, the quality of life is lost. After that also, the 5-year, you know, whenever we treat patients for cancer, we always talk about 5-year survival. The 5-year survival rate of patients suffering from oral cancer, even when they are treated by it, is not very good. So it is always better to pick them up at an early stage, which is prevention. It manages to save a lot of funds, because you don't have to, you know, the cancer, we have picked it up at an early stage. So that is one area where I have done a lot of work. I was also talking about this with dentists, teaching them and educating them how to pick up oral cancer at an early stage. So early detection of oral cancer and prevention is actually a worldwide thing now, and we all are working towards it. And in every aspect, actually, we are more focusing on preventive measures more than you know, curative, because so many times there is no cure, and particularly when it comes to cancer, there is no cure. Having said that, there is another aspect of cancer which I deal with, which is called dental oncology. So there are several patients who are medically unfit, or they are undergoing cancer treatment, cancer therapies. And these are the sect of patients who are very, very delicate, if I may say so. They are very fragile. And these patients require very specialized dental care. You know, so these patients, when they land up with a general dentist who is not aware of how to manage these patients, because these patients are taking a lot of medications, and the medications have an impact on the jaws and the teeth. So if these patients land up with in a general dental clinic, then there is a very high possibility that complications may happen. And that is also a possibility with medically unfit patients. A medically unfit patient who is taking several medications requires very, very special care and knowledge on the part of dentist. Okay, so in cancer, particularly the dental oncology, if I'm not mistaken, we don't have anybody who is practicing dental oncology in Goa.
Elaborate oncology.
Oncology. So oncology, sir, is the word which we use for cancer. The study of cancer or understanding of cancer is oncology. And dental oncology is how cancer and dentistry have come together. Okay, so dental oncologist is a super GP. In America and other parts of the world, they are called super GP. They are super general practitioners. They are not regular general practitioners, but they are super general practitioners. Because what happens is that these people have a proper understanding of the drugs which these patients are taking, what are the side effects these drugs will have, how to manage these side effects. And what happens is that dental oncologist has a role to play before the treatment starts, while the treatment is going, cancer treatment, and after. So because these patients require continued treatment.
Subscribe Prudent social media channel and press bell icon for latest notifications.